Hello, this is Ron McCullough, consultant podiatric surgeon. We often get asked by patients how you can tell yourself whether you do definitively have a Morton's neuroma. Well, it is true that obviously scans, particularly ultrasound scans, which we perform at our center, are in many ways a gold standard, although there is a caveat to that because you can have a non-symptomatic Morton's neuroma. So it's really the scan in combination with a positive Mulder's sign or a Mulder's click that clinches the diagnosis. Now the question is, can patients do Mulder's click or Mulder's sign on themselves? Well, depends how dexterous you are, and it might be difficult to get your foot up in a position to do it, so you could ask somebody else to do the test for you. It is obviously going to be a bit more hit or miss compared to somebody like me who's performed thousands and thousands of these tests, but I'm just going to show you how the test is done so you can have a go, so to speak. So basically, when we look at the foot, what you need to do is, if I first get this skeleton here, you can see that at the base of the toes there is this yellow line which represents something called the intermetatarsal ligament. And now what happens is that the nerve presses against that ligament, and as a result it becomes squeezed, and then when the nerve is up and being pushed by ground force and the foot squeezes together, the nerve gets flicked across the bones and you get your symptoms. So the way that you do the test is you need to grab the person's foot or grab your own foot. You press directly underneath the area between the toes. So you go to the base of your toes and then you go in between them, either between the third and fourth, because you can get neuromas between the third and fourth, or between the second and third. And what you do is you press quite hard between the third and fourth toes. Let's say it's there because that's the most common location. And then what you do is with the other hand, you squeeze the foot together. So you push up underneath the third and fourth toes or the second and third, because you can get them in either. Keep that pressure on and then squeeze the foot side to side. And you will feel a little click and a flick, and the patient will often describe that as being painful. And that's important as well, because sometimes you'll get that click, and if there's no pain, it may not be as clinically relevant. But if the patient or the person complains of a discomfort whilst that click is felt, then it does mean that in all likelihood they have a painful Morton's neuroma. This is different to other conditions of the foot. If you have a problem with the joint underneath your foot, the pain would actually be underneath the joint and not between the joints, between the toes. So the key thing is to exert the pressure between the toe, push up and squeeze. And if your indicator in that situation is positive, if your patient says it's painful, then you know they probably have a Morton's neuroma.